This is Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We're brought to you by the Butterfly Network.
All right, I'm going to let you in on something that's completely changed the way I practice. I've been using butterfly probes for years. It's a portable ultrasound that plugs directly into my smartphone or tablet, so I can start scanning at the bedside in seconds. If you've used older versions, or even if you're new to the handheld ultrasound game, let me tell you a little bit about why this new IQ3 is a game changer and really impressive. First off, having an ultrasound that literally fits in my pocket means I can move faster, whether it's vascular access, procedural guidance, or just getting real-time insights from my patients. And the tech inside this tiny device is pretty incredible. Biplane imaging lets me see short and long axis simultaneously, which is huge for procedural guidance, and honestly, a great tool for learners. The new needle out of plane preset even shifts the scan plane digitally, so I can see the needle tip sooner, which makes a real difference when precision matters. And the image quality, honestly, this IQ3 holds up against some of the high-end cart systems I've used. That's impressive for something this portable. If you're looking for a device that supports your practice, I can't recommend the Butterfly IQ3 enough. And right now, they're running a special offer. You can get $750 off the latest IQ3. Check it out at butterflynetwork.com.
All right, today we are talking about RIP Kyle Busch and kind of the medical explanation behind his surprising death, which was May 21st of this year, a week after he won a Truck Series event.
That's right. And the caveat is I have no independent knowledge of this besides what's been published in the news, so I cannot make a definitive diagnosis. But we're going to talk through sort of what the news had to say, what that kind of means from a medical perspective, and then what my thoughts are on what happened and potentially why it happened.
So he was racing in the NASCAR Cup Series. He's won it twice, one of the greatest NASCAR racing champions of all time. Got his start in Las Vegas a number of years ago, back in the
his brother,
I would say 80s and 90s.
Older brother is Kurt Busch.
That's right.
Who won a bunch of races as well. I used to watch a lot of NASCAR with my dad back in the day, and actually did NASCAR fantasy NASCAR.
Did you really?
Oh, yeah. It was great. Yeah.
And kind of interesting we're doing it today because it is the running of the Indy 500 today.
Yep.
So let's just talk about what has come out in the news, because when we heard about what happened, it was, he went to the hospital because possibly he was coughing blood.
Right.
And then he was unconscious. The family put out a statement on social media and said that we ask that you, pray for our family and respect our privacy. Yeah. And then all of a sudden the news comes out that he has passed away. So walk us through, I guess, now that it's come out a couple days later, we're finding out that he possibly, the initial diagnosis was pneumonia untreated,
likely
sepsis.
Yeah. So just for background, Kyle Busch was a 41-year-old healthy guy. I mean, these NASCAR drivers and Indy drivers, they're in pretty good shape. Well, I mean, the exception of a few who later in their career got a little bit bigger. But, Kyle Busch at 41 was in exceptionally good shape, won a bunch of races. He actually drove all the different series. So,
Truck Series.
For those who don't know NASCAR, there's a Truck Series, which is sort of like, the lower level series, and then there's another series in between, and then there's the higher level championship series. And so he drove all of them just because I think he loved to drive. Yeah. His older brother Kurt Busch won a bunch of races as well. So we're looking at an otherwise healthy guy in his early 40s, which is kind of like you and I.
Right.
And so just talking about what probably happened. So it sounds like he was in a race a few days before, maybe a week before, where he thought he was having some sinus problems, and so he wanted a shot afterwards. Best guess, that shot was a steroid that reduces the inflammation, can help with a sinus infection. So,
do you think this had anything to do, because the race was I think it was kind of in the mountains in New York, anything with altitude? Or
probably didn't matter. Yeah, or the Poconos or something. Yeah, it probably didn't matter. Most sinus infections, it's kind of 50-50 whether it's a viral or a bacterial infection. Potentially he had a bacterial sinus infection, which, if you don't treat it with antibiotics, can worsen. Your sinuses are connected to your lungs. So again, this is all completely
based on
conjecture. Yeah, we have no independent knowledge of this, but potentially he's got a sinus infection that's a bacterial sinus infection. It goes down into his lungs. The pneumonias that make you really sick and kill you are typically the bacterial ones. There are some pneumonias that are viral. they can be very serious as well, but don't typically progress to like a sepsis type issue. So, he's got that. They give him a shot of steroids, which makes him feel better, but doesn't treat the actual infection, because while viruses, your body just kind of handles on their own, usually bacteria, you need some sort of antibiotic. So potentially that goes to his lungs. Potentially then he, continues to race, doesn't slow down, doesn't take an antibiotic, doesn't get proper rest and recovery and all that kind of stuff. Gets back, and I think he then was in a race simulator
midweek
doing
or
some
whatever.
Training, and felt terrible, passed out, and started what they said was coughing up blood. We'll talk a little bit about that later. My guess is that it wasn't actually coughing up blood. It was more of a when you get something called pulmonary edema. There's you get leaky capillaries, and so it looks like this. It's like this frothy, almost like pink sputum that comes up, and so that's not, it looks a little bit bloody, but it's not truly like coughing up blood where you would have if you had like a bleed into your lungs. So best guess is it was some sort of bad pneumonia. There's a lot of different bacteria that can cause pneumonia, and we see this a bit, and I'm not in the emergency room anymore, but talking to some of my emergency room colleagues, we can see this in young 18 to 50-year-old men who get really bad pneumonias. And if they don't get in and get treated, they can get very, very sick. Best guess, that's what happened. He got that pneumonia. As the pneumonia started to progress, he got something called bacteremia. So when you don't treat a bacterial infection, sometimes that bacterial infection goes from whatever's infected, lungs, leg, heart, whatever, into the bloodstream. And so then it's bacteremia. So bacteria and then emia, blood. So bacteria in the blood. Now that in and of itself doesn't mean that it's sepsis. So we'll have to define sepsis here at some point too. But so pneumonia goes into the blood, starts to get sicker. Now what sepsis is a combination of things. So it's your body's response and then also an infection source of that bacteria in the blood. So, and this is a little bit complex, but basically when you get sepsis, you have to meet criteria for what's called SIRS, S-I-R-S, Systemic Inflammatory Response Syndrome. And so there's 4 criteria for that. It's based on blood pressure, heart rate, temperature, and blood pressure. Man, don't remember the 4th one. Blood pressure, heart rate, temperature. Well, darn it. You'll have to look that up for me. I don't remember the 4th criteria.
I'm on it.
Yeah,
I'm on it.
I don't do this kind of medicine anymore. So
here we go. First thing that pop up. SIRS criteria.
Yeah. Blood pressure, either low or high, but typically low. Heart rate, typically high, above 90. Temperature, just meaning you've got a temperature above 100.
I feel like I'm quizzing you for your white blood cell count.
White blood cell count. Yes. So you've got to have an elevated white blood cell count showing that there is some sort of inflammation going on. And to be fair, people think about white blood cell count as only infection. That can be an inflammatory response of any sort too. So you got to meet those 4 criteria, at least 2 of them, I believe, to meet SIRS criteria.
I'm just, while you're explaining this all, SIRS, pneumonia, sepsis.
Oh, there's more acronyms to come, but go ahead.
I'm just thinking in my brain, how rare are all of these in a healthy 41-year-old male who's never experienced anything like this before?
Uncommon, but not rare. So we do see, again, we see young, and I would consider that young, 20 to 50, young, especially males who in general don't take as good a care of themselves, come in with like rip-roaring pneumonias. Now, most of them aren't highly tuned athletes who are ignoring the symptoms to go race cars, but there are people.
Probably had a cold or some sort of respiratory. So
based on what I heard about that one race, he was talking about how bad his sinuses hurt. So maybe he had a sinus infection. And so a cold, an upper respiratory infection is almost always viral. So again, you can get a viral pneumonia, but that doesn't usually cause overwhelming sepsis. Sepsis is almost always caused by a bacteria. So my guess, again, not knowing anything specific about his case, is he had a sinus infection that he didn't treat with an antibiotic that went into his lungs. You know, they're all connected, right? So that would be my guess. It wouldn't just be a cold. Okay, so SIRS criteria, like I said, and then he's got that bacteremia where he's got the bacteria, whatever it was, in his blood. And eventually, over time, all of that stuff comes together and shuts down your organs. And so typically what happens first is your kidneys start to shut down. And then, you get all kinds of things like all the nasty substances build up in your blood, right? That your kidneys filter out. You stop making urine. You start to feel terrible, right? People with sepsis feel awful.
Would this be like, is this a quick?
Yeah, it can happen within 6 hours.
Oh.
Yeah, I mean, it can
not
be
like 2 days. This is
yeah. So the whole progression of sepsis is longer than that, but going from sepsis to what they call severe sepsis and then septic shock can happen in hours. And then other things shut down. So like your heart starts to shut down, so you get hypotension, low blood pressure, liver, all kinds of stuff. What probably happened to him, and again, I'm totally surmising this based on what people said, but my guess is he got what's called ARDS, acute respiratory distress syndrome. So that's sort of like the functional equivalent of sepsis, except in the lungs. And so when that happens, so he's already got a knock to the lungs because of the pneumonia. He gets this overwhelming inflammatory response in sepsis, and then that starts to attack the lungs, and it makes the capillaries, the blood vessels where the veins and arteries connect on the outside of the lungs, start to be really leaky.
Okay.
And so a bunch of fluid and blood comes into the lungs. And then as that happens, you start to cough that up, and it basically causes a pulmonary edema as well. So that's what I'm talking about, that pink, like frothy
fluid.
Almost looks like melted strawberry sherbet that he would cough up. So I'm guessing when they called and said he's coughing up blood, that's probably what he meant.
And how do you treat that?
Yeah, so it's all supportive treatment. So the treatment of...
Because it's a virus still.
Well, it's a bacteria.
Yeah.
But you would have to... So you're treating the bacteria with antibiotics, right? So early sepsis. So let's say he went in as soon as he noticed that the sinus infection was getting worse. He went in. He got treated with either oral or more typically IV antibiotics. Typically, they put you in the hospital for a couple of days. They treat you with IV antibiotics. Once they treat the infection,
right,
the sepsis, the SIRS stuff resolves and you're fine. Once you get into that septic kind of, swirling down the drain type thing, at that point, there's all kinds of supportive care. So you would have had to bring him into the hospital. You give him antibiotics to treat the infection. You give him a bunch of IVs and a bunch of IV fluid to treat all the hypotension and all the shock symptoms. If he truly did have ARDS, the lung infection or the lung issue, you would probably intubate. You would treat that way. There'd be all kinds of suction and percussion things you have to do. Then oftentimes if people have really bad ARDS, you put them in a prone position. It allows the lungs to actually bring, oxygen into the body a little bit better. And then kind of the final Hail Mary thing you can do is hook them up to an ECMO machine, which is like a heart-lung bypass machine. Kind of like people did for COVID.
Sure.
And so you'd put him on that for a couple of days till you could clear the infection so that you could still oxygenate his blood. So there's a lot of things you could do. But at some point, it gets to the point where you can't treat it anymore. And I'm assuming, when that 911 call happened, he's laying on the floor coughing up what I assume is pulmonary edema fluid. At that point, it's probably too late. I mean, no matter what they did, they could have brought him in the hospital. It's probably too far gone at that point.
Well, and a lot of people at that point, I mean, not at this point, but a lot of people, I know I have in the past, you kind of ignore.
Yeah, especially men. Yeah.
If you have a sinus infection, you're like, I just have a sinus infection. It's not that big of a deal. Is this kind of a unfortunate warning?
Yeah, I mean, maybe. I mean, it's not rare, but it's uncommon that a sinus infection turns into pneumonia, that turns into sepsis, that turns into killing you. So again,
you got to be ignoring those signs for sure.
Yeah,
at that point,
he would have had some pretty severe, shortness of breath and fatigue and all that sort of stuff when he got the true pneumonia. But also you've got a guy who, and I'm not blaming the doctors. So again, I don't know the situation, but if I'm his physician and because these guys are seeing physicians constantly.
100%.
Right? So if I'm his physician, I'm like, no, you're not getting in the simulator. You're not racing today. You're going to the hospital right now. So I don't know. I mean, and it's not like the physician could have physically drug him to the hospital, but you would think somebody who's seeing physicians this often somebody would have said you are not right. Get to the hospital.
And I think a lot of people who don't understand racing don't understand the stress that it puts on your body.
Oh, yeah. It's
I mean, they're athletes.
Yeah. They say they sweat like the equivalent of, 5 marathons in one race. And
just imagine driving 200 miles an hour.
For 2 hours straight.
For 2 hours straight. And I'm having a tough time on the snow for 15 minutes.
Yeah.
So again, I mean, I think the G forces on your body.
They need the Tesla auto drive thing. You just hit a button. Keep turning left. Just keep turning left.
At 200 miles an hour, I'm not sure.
I don't know. I mean,
but again, the stress on your body.
Talking to you, Elon.
You have to know when is when, right? And I think like for these athletes, Tiger, whoever, right? I'm not comparing him to Tiger, but if you're a top tier athlete, you push your body so hard.
Yep.
Where's the line? Where's the line? Where's the point that you're like, I'm 9th in the Cup standings right now. Memorial Day weekend is ahead. I'm 41 years old. I've got a family.
Yeah, 2 kids. Yeah.
Where do you draw that line? I don't know. But again, the question I'll ask you is, should this be a
warning sign?
Yeah, like, you know what? Like, maybe this time I'm not going to ignore that. Because ultimately, is it the sinus infection that killed him? A bacteria infection? I mean, you should go to the doctor earlier.
Yeah. And particularly, so generally what we tell people is, if you've got, let's say you've got what you think is a sinus infection. If it's not gone or improving in about 48 hours, it's time to see your physician. Now, they may get you in there and say, it looks like a viral infection, treat it with some Tylenol and rest and that sort of stuff. But oftentimes they can tell, whether they do a swab or whatever, like, hey, this is a bacterial infection. You need some, often we start with amoxicillin, like a penicillin-based antibiotic. But they can tell what's going on, and at that point, they're going to give you some antibiotics, and then typically that antibiotic treats it. But you still have to rest. I mean, there's still like, it takes a toll on your body. You still have to rest, which I'm sure he was never going to do. But
rest, R-E-S-T.
That's right. Sleep as medicine, man. Sleep as medicine.
Started to do a lot more of that in my 40s.
Yeah.
Hey, I used to push my body to the absolute limit of whatever it was, So did
I, yeah.
And I've kind of learned that your body needs that recovery. Your body needs that recovery to, be as good or better tomorrow than it is today.
Yeah.
Because pushing it at 45 is different than 35.
Yeah.
It is.
And 25.
It is. Yeah. It is 100% different than pushing it at 35 and 25. So RIP Kyle Busch. Again, one of the greatest racers of all time.
And we may do a different podcast on this one, but I think there's a lot of new things that come out with sepsis all the time. So I think there's some new treatments and some new medications and all that kind of stuff. I mean, the mainstay is the antibiotics and the fluids, but it's
nothing over the counter.
No. It's at some point there was some descriptions of using steroids that maybe did or didn't work. There were a couple of drugs that came out from a couple different pharmaceutical companies that maybe helped, maybe didn't. But I mean, it's still, sepsis is one of the hardest things to treat in the ICU, especially when you get to severe sepsis, and especially in older folks who aren't healthy. Obviously, he was a young, healthy guy. The problem with him is probably that it was so far gone by the time he got in. But yeah, sepsis continues to be one of the major killers of people who come into the hospital with infections.
This has been Going Under, Anesthesia Answered with Dr. Brian Schmutzler. I'm Vahid Sadrzadeh. We are brought to you by
the Butterfly Network. And see you next time. Stole it from you.
Always, man.